is that indigested material. So there will be deterioration in the food intake, or there is a faulty direct area or something which is directly cause for mamopathy. But it's not so. Na kevalam, na kalu kevalam atimatram eva aharam rashim amapradoshakaram ichanti. Please do not stick on to the policy that only atimatra ahara bringing the ama. अपितु खलु गुरु रोक्ष शीत शुष्क दुष्ट विष्टंबि विदाहि अशुचि विरुद्धानाम अकाले च अन्नम उपसेवनम. So there are plenty of rules and regulations told by Charaka, Sushruta, everybody, where it is told that Guru Ahara, one should take the Guru Ahara, it should be taken very less. Ruksha Ahara, Satata Sevana, leads to deterioration of the Vata, Shita, Shushka, Vishta, Vishtambi, Vidahi, Ashuchi. All these are primarily responsible for deterioration in the form of Amma. And it's not the limitation of this Ahara only. Still he adds, Charaka adds, saying that Kama, Krodha, Lobha, Moha, Grihi, Shoka, Mana, Udvega, Bhayopatakam, Bhayopatakam Va, Yadannam Anapanam, Annapanam, Yujati, Tadapi, Amami, Pradushayati. Food is very calculated and quality-wise good, but the patient or the person may not able to take in a pleasant manner in the sense with the holding of all the deterioration in the mind. Hence, is supposed to happen to meet with the Kama, Krodhadi, Arishadvarga, and more than that, the deterioration of his mental faculties or say that emotional factors leading to ultimately blow on digestion properly. So there is one more cause for Amodpati. So we have various category of food. We have the quantity of the food and ultimately the improper mind or unpleasant mind is also responsible for ama. So ama is wide and variant. It may happen because of any of the reasons or all the reasons at a time. Accordingly, it has an impact over the body by which ama lakshanam patanti dravam guru anekavarna hetuhu sarvroganam snigdam pichilam mamam tantumat anubadha shulam. So all these are the qualities of ama. And coming to the effect of this ama, it leads to blockage in the channel, Sroturoda, Balabramsha, vitality loss, Gaurava, Anila Mudaka, leading to heaviness in the body, Anila Mudaka. The proper movement of the or Anuloma Gati of the Vata is perverted. It may lead to the Viloma Gati or deterioration in the Anna Shrotas. Alasya Bhakti Nishtiva. So lethargy is an outcome when there is indigestion and improper digestion. Apatti, once again, the ajirana continues. Nishtiva, excessive repeated spitting or salivation. Malasanga, constipation may occur. Aruchi, klama, anayasa, vishrama. So these are caused by the effect of samamala or the collection of indigested materials leading to malinikaran of the deha, and on the other hand, the contradictory to all these qualities are considered to be the quality of niramavastha. By this, we can understand that there are two conditions. One is amavastha, and there is one more niramavastha. How far this is elaborated and how far it is distinguished from other things are explained in the next slide, where Amena Tina Samprata, Dosha Dushascha Dushitaha, Sama Ityupadishyante, Yecha Rogaha, Tadudbhavaha. When the dosha, the fundamental factors of the body, going to combine with this sama, they are called as sama, dosha, sama, dosha. So we will have vivid picture of the dosha instead of its quality and the work it carried out, and it becomes ineffective in managing its activity. More than that, it becomes virulent and it leads to rogaha tadudbhavaha. So, echa rogaha tadudbhavaha. This is the root cause for many of the disease to continue. So, amena tena sampraktah. So, ama is a toxic factor combines with the dosha, dusha, any dosha becomes sama. This word sama dosha is labeled. For example, Samavata is explained in the context by the same by Bhagavata, Vayu Samu Nibandhagni Sada Stamba Antara Kujanihi Vedana Shofa Nistodehi Kramasho Angani Pidayan. This is most important. Kramasho Angani Pidayan. This toxicity is producing the damages slowly, steadily for each and one part of it where it is lodged or located. Vayu Samu. So Vibandha Agnisada, so constipation, Agnisada, further deterioration in the Agni level, Stamba, Antrakujanayi. So there is Antrakujanam, Stambha, or stagnation of the movement of the Vata, and Vedana Shopanistodaihi. Once again, two things will be observed here Vedana, Shopa, Nistodaihi. So there will be inflammatory process going on with the painfulness and leading to Kramasho Angani Pidayan. Slowly but steadily it is spreading to the other areas of the body. Vicharyet Yugapanjapi, Granati Gopito Brisham. Once again, by moving all of a sudden, it simultaneously it leads to further vitiation of the dosha and the speciality here is whereas Vata is pleased by Snehadyehi, but here Snehadye Vriddhimayanti. Instead of getting relief from the Vata Vriddhi or Vata deterioration conditions, when the Samavata is persisting, one is going to get deterioration or increase of the symptoms and signs by the Sneha Upachara or application or intake of Sneha Bhaga or Snigdha Dravya. And even same thing is seen as Surya Meghodayu Nishi. Suryodaya Kala, Meghodaya Kala, and Nishodaya or the early part of the day, night, and during the cloudy days. This is also very typically seen because of Vata combining with this Ama. So Sama condition, Sama Vata condition is explained here. This suits more with the symptoms seen in the course of the disease of Amavata also. But Samavata is somewhat different from Amavata. Going to the Samapita, Durgandhi Haritam Shavam Pittamam Lamganam Guru, Amlika Kanta Dahakaram, Samapittam Vinidishet. Once again, Samapita appreciation is seen by the identification is seen by the Durgandha, Harita, Shava, Pitta, Amlam Ghanam Guru. So Amlika or the soul irritations and Kanta Hrit Dahakaram. So burning sensation in the Kanta Pradesha and Hridaya Pradesha is also a part of the Sama Pitta. When the Pitta combines with the Ama, these things are observed. Similarly, Sama Kapha is explained. Avilaha, Tantulaha, Stanaha, Kanta Deshe Avatishtati. Kantha Deshe Avatishtati. So it is blocks in the Pradesh of Kantha Pradesha. Samo Balaso Durgandhi. So once again, Durgandhata is explained. Kshud Udgara Vighata Krita. Once again, the normal gati of Kshuda, Udgara, or the urges are suppressed because of the Samakafa. Once again, Sama condition, Ama combining with the Kapha leading to the Samakafa. All these opponent qualities are considered as Nirama Avastha of the particular dosha. Same way, Nirama Vata Lakshana, Nirama Pitta Lakshana, Nirama Kapha Lakshana is also seen as a part of the manifestation of the Nirama Avastha. So once the Ama is relieved, it becomes Nirama Avastha. Hence, all the opponent qualities are the Nirama Vata, Nirama Pitta Lakshana is also observed. Come to the Amavata proper. When the Ama and Vata are combined, we have two words here, Ama and Vata. Ama already explained, vitiated Vata combines with the Ama because of the particular attention to the Viruddha Ahara Chestasya. Once the patient is or the person is habituated to consume food which are viruddha. Viruddha refers to here, explained by Annapana Vidyadhyaya by Charaka, that may be rasa viruddha, guna viruddha, sanyoga viruddha, etc. So, viruddhahara, when we talk about the viruddhahara, we say that matsya and kshira together. That's one example, the virya viruddha. On the other hand, we have n number of other varieties of viruddhahara, and all these are responsible for initiation of the Amavata. Viruddhachestra. Viruddhachestra is once again the erroneous habits and abnormal or faulty diets like Mandagni Visarasyaja. Usually the Mandagni status is observed to go for various activities of Agni potentiation. One of them is Vyayama or Sharira Ayasa Janaka Karma, which is not observed by a person who is suffering from Mandagni status. Though feeling that appetite is reduced or Agni is deteriorated, the person is still feel that he is sticking to his asana, or he is not going for any types of physical exertion. Snigdham bhuktavati annam. Immediately after taking the sneha yukta ahara, he is going to perform vyayama, which is once again contradictory process or viruddha ahara and viruddha chesta. So after the intake of the snigdahara, it is better to not to go for any heavy exercise, so that the phase of digestion gets abnormally motivated. Abnormal motivation of this hara leads to indigestion, and digestion produces ama, and that when combines with the vata becomes samavata or amavata is produced. That's why Amavata Samprapti is quoted. Vayuna Predito Hyamaha, Klishmastanam Pradhapati, Enatyatam Vidagdoso, Damanihi Pratipadyate. Vayuna Predito Hyamaha, Klishmastanam Prabhavat. Once the vitiated Vata, along with the Ama and Vata, moving towards Shleshmasthana. Shleshmasthana refers to the area of Shleshma or the Kapasthana, and the upper part of the body. Tenatyartham vidagdo saudamanihi pratipadyate, especially the Vakshasthala or the Hridaya Samipastha Pradesha, which is once again uh, supposed to be Vidagdata or Vishishta Dagdata of the Ama takes place, and Damanihi pratipadyate. It moves through the Dashadamani. Vata Pitta Kapayir Guyo, since all the doshas are in all the Shrutas embedded. Hence, they are moving with the Vata Pitta Kapha, and because of this, vitiation, further deterioration takes place, and Abhishandina, the blockage of the channel takes place. Nana Varmati Jilaha, it has so many other colors which are not the normal color. And moving on, Vyadinam Ashayokesha Amsabnoti Dharnaha. So it's a root cause for, it is the root cause for many of the disease, which is an impact of ama in the body. Kupitavantaha, Trikasandhi Praveshako, Stadancha Kurdegatram, Amavadas. When it is all of a sudden, or along with the Vata and Ama, it moves towards the Trikasandhi. Trikasandhi is the joining place of three bony structures. There are few areas in the body, and they are taken up by this Samavata. And because of this, Stabdata of the Gatra or the body takes place, and this particular vyadi is called as Samavata. There is no right Purarupa of Amavada, but Vangasena explains some of the things which is supposed to be the Purarupa stage of Amavada only. Where he says that Ajirnadyo Rasajata Sanjitaha Krankrmena Vai Ama Samnyam Salavate Shirogatra Rujakaraha. Ajirnadyo Rasojataha. So because of Ajirnadi Karana or the reasons, the person gets abnormal ahara rasa, which is going to accumulate and leading to important symptom like rujakara shirogatranam, the head as well as the upper part of the body as well as the whole body is going to get experience with the painfulness. Moving on. Lakshana Pamavata Namarda Krishna, Alasim Romjaraha, Apaka Shunatangana, Amavata selection. Important symptoms as a part of the manifestation of the Amavata is noticed by Angamarda, body ache, Aruchi, the loss of taste or distaste, Krishna, the excessive thirsty, is responsible for repeated demand for water too, so that it tries to compensate the indigested materials to digested. Alasya, the lethargy, gaurava, heaviness, jwara, apaka, indigestion, chunatanganam. Some parts of the body, dependent parts, are going to get swollen because the impact of ama is produced in the form of shotha or shunata amavatasya lakshanam. So we can observe the important symptom like angamrata may be interpreted as a pain, and alasya and other speeches, gaurava, etc., refers to the stiffness of the body, and ultimately swelling or shodha is shodha, shula, and stabdhata of the deha is considered to be the hallmark of the disease. That's why amavata is identified by these three symptoms. सर्वांग एकांग संधिस्तः शोधार्थी ग्रह गौरवम ज्वर अपाक अग्निमंद्यो च मंद्ये च कृष्णा च आमनिलाकृतिः अंजना निदान, a text which is consisting of various extraordinary informations. It says that sarvanga ekanga sandhistah. So it produces the shotha pertaining to shotha and shula pertaining to sarvanga ekanga sandhistah. Either it may be all over the body or one part of the body, or it may be located with the bony joints or joints of the body. Graha stambha or the stiffness, gauravam heaviness, jwara apaka agnimandya are the other features along with Krishna because of amanila or vata combining with the ama or so-called the ama vata lakshana explained by Anjana Nidana. And moving on, there are some features pertaining to the dominance of particular dosha to identify. That's why you can have the prabheda of amavata in the sense pitta sadaragam. So once again, the daha burning sensation and the reddish coloration over the affected area is noticed in the predominantly along with the amalakshana by pitta dominant, and the pain is intense and severe, and it is a part of the vata pradhana amavata, and stimitata, gaurava or the heaviness, and kandu are the features related to the kapha dominance. So accordingly, one can have the differentiation clinically and one can treat accordingly. Amavata vate ati rukdaha suvitadaha Kapha Saivitya Gurute Sarva Lakshma Vishi Tridoshatah. Anjan Nidanam again says that Amavata Dikevate Atiruk. So severe pain, Dahas Pitataha, burning sensation will be along with the other features of Amavata by Pitta dominant. And Saivitya and Gurutva or the heaviness are the observed by the part of the Kapha dominance. All Lakshanas seen especially in the when the amavata is produced by all the dosha at a time or three doshaja. That's what Anjana Nidana says. Sakasha Sarvaroganam Yada Prakvito Bhavait Hastapad Shiro Gulfa Trikajanur Sandisho Karoti Sarvijam Shotam Yatra Dosha Prapadyate. This is most important. One may have difficulty in managing as the disease progresses because it moves all over the body and extends to the various parts of the body, or especially the joints like hasta, pada, shiro, gulfa, trika, janu, sandisho. So sandhi pradesha of hasta, pada, shira, gulfa, trika, janu, uru sandhi, etc. are going to get more extended inflammation and such produce symptoms by when the disease progresses or prabudha mamata is produced. Karoti sarvajam shotam. Once again, painful swelling is experienced whenever the dosha is going to lodge in particular place. So they show Runjati Atyartham. That particular area going to get more painfulness. Yaviddaiva Vrachikahi. This is very typical nature of the pain experienced by the patient. Vrachikatam Shavat Vedana or the scorpion bite. So scorpion bite, similar pain is experienced that the person is the advanced stage of the Amavata. जनयेत्सु अग्निदौर्बल्यं प्रसेकारुचिगौरवम् उत्साहहानि वैरस्य मुदाहं च बहुमूत्रताम्. As it go on increasing or extending or the chronicity of the disease leads to further deterioration of the agni, excessive salivation, distaste, heaviness, utsahahani, or say that the person may have the lack of interest or cheerfulness, virasata of the tongue, and dahancha bahumutratam. So once again, this debris are going to accumulate, hence the person experiences with the bahumutrata, repeated urination. Ukshotrinata shulam. The essence of hardness and pain is experienced along with Nidra Viparya. Nidra Viparya refers to the Ratri Swabhava Nidra is replaced by the Diva Nidra, or patient feels as if drowsy or feeling sleep in the during daytime, since he is not getting the proper sleep at night because of the pain. Trit Chardi Brahmamurchacha, Tilgraham Viduvadatam. Once again, Trishna Chardi Brahma Murcha, Hridgraha, Viduvibadata, or the constipation, Jadya. So once again, the lethargy, Antrakujana, the gurgling sound experienced or heard from the intestinal as a part of the indigestive materials, Anaha. So there is flatulence and Koshtascha Anyan Upadravan. It produces a number of other Upadrava or complications as it get increased or progressed in the body itself. Since there is no proper medication, no proper treatment in time, hence it is going to advance to a stage where the most of the complications are produced. Coming to the prognostic values, if at all it is associated with only one dosha, vata pradhana, you can treat well, very well, because the treatment may have contradictory. On the other hand, if at all it is a didosha, the one treatment may hamper the other thing, and the treatment becomes tedious, and the patient may not satisfy with the proper regimen advocated by the physician. Sarvadeha Charaha Shotaha. And if at all it is all over the body, moving and producing the Shota, because it's still in the circulation, and it's considered to be very difficult to manage. And if at all it is Sannipatika, all the doshas are participating equally. Once again, the person may not have um, easy outcome from the treatment or the disease itself. Hence, it becomes either a krichra, or sometimes it's yapya or asadhya even. That all depends on the how and when the patient arrives at the treatment, and what the treatment is properly managed or not, or the treatment is effective or not, or if the treatment is effective, how far the patient is adjusted to the dietary as well as other regimens, or lifestyle is changed or not. So many of the patients comes who get early cure, but may come with the second exacerbation or the remission, saying that it's very intense or something. Either it may be a faulty diet, or it may be a natural one because of the climatic change, or the particular advancement of the disease may not suit with the same medication. Some proper medication has to be changed according to the Avastansara. Coming to the Upadrava, once again, the Upadrava is considered to be the stage where the disease is maltreated, ill-treated, or not timely treated, or if at all it is ill-treated. And the person is going to have all the features like Prabhudamohata, where we will see Jadya, Antrabhojana, Trut, Charadi, Bahumutrata, Shula, Shayananasho, Upadravaha, Amavatajaha. So once again, Nidranasha is a complication of Amavata. Many of the patients complain of loss of sleep and intense pain, or the intolerant pain, and more than that, all the symptoms of the advanced stage of the disease being a part of the Upadrava itself. कुक्षुकठिनताशूलं निद्राविपर्यं त्रिट्टजब्दि ब्रह्मश्वास ऋतुग्रहं वैर्भवन्दतां त्याड्य अन्तरकोज आनाहं कष्टांस्य अन्यान् उपद्रवान्. It says that anyan upadravan. For this, we have a commentary saying that there is anyan upadravam, vata vyadhi ukta anya upadrava should be suspected, especially kanja pangulya can be considered here. Kuksha upatinada shulam nidra viparyam. Kastam Sanyan Upadravam, same thing is quoted by Yogaratnakara too. By all this, we come to know the fact that the Amavata produces a very small change in the body, extends itself to a varied and widely, and becomes more virulent and produces the damage, or there may be under Vaikalya or the various damage to the tissues and the body as a whole, and ultimately becomes improper to difficult to treat. And if at all it is managed in the early stage, it saves all the outcome in the form of complication, as well as avoids the patient to struggle for a lot. Hence, proper treatment arrangement has to be carried out by going through the features and the specificity of the symptoms and evaluating the prognostic values, and has to arrive at the chikitsa. Saying that, Langaram Swedanam Tekam Deepanani Katunija, Virechanam Snehapan, Basayas Chama Marti, Rukshasvido Vidhatavyo, Paluka Potale Istata, Upanahas Tekatavyo, Ti Apisneha Virjitaha. All Shastra, all the classics say that you have to arrange such a treatment which is pleasing both Vata and Ama. So it is uncertain that the available treatment may either increase the vata by the ama treatment, or ama treatment may be triggering the vata. Hence, the balanced treatment has to be carried out. By this, it is very essential to check Agni always, because Agni is the vital role, has a vital role in either deterioration or sluggishness of the symptoms. And moreover, all the medicaments what we are going to advocate should be well digested. Unless and until it is well digested, one cannot get the easy cure. So it should be started from the Langana. There are certain varieties of Langana quoted by in the Shastra. Dashavidha Langana by Charaka, and 7 types of Langana by Vagbata. But out of these, Langana here refers to the Lagvanapana or Upavasa. This is most suitable because of there is drawbacks of other varieties of Langhana variety to adopt in a patient suffering from Amavata. Hence, one can adopt Langhana being the prime treatment for the purpose of outcome of the Amavata initially, and slowly the Agni gets deteriorated, increased, and by which other treatments will be more efficacious or more effective. Swedana is advised, and if you go through the once again, Swedana, once again, one cannot go for Snehana Purvaka Swedana. Usually, when the Swedana is carried out, usually we go for the being a Purvakarma in the form of Snehana. It may be Bhakya Snehana or it may be Abhyantara Snehana, but it should be avoided that all types of Sneha in the course of the treatment as a whole, because any Sneha either in the form of Bhakya Parimarjana or Anta Parimarjana due to this situation, hence Svedana is in the form of Ruksha Svedana. Tikta Deepanani Katudija. Though Tikta Rasa and Katurasa are increasing the Vata, when the Amanvita Vata is persisting, one can effectively manage with the Dikta, Deepana, and Katurasa Pradhana Dravya, which once again increases the power of digestion and Agni, by which the further deterioration of the situation is stopped, and moreover, the Ama gets Niramata and can treat the other symptoms or the remnant symptoms of the Amavata by easily. Virechana is quoted here. Virechana has two way of thinking. One is the Sadhya Virechana or the Snehana, Svedana, Purvaka Virechana. Since there are certain Snehan Dravya which may be adjustable to have orally, like Shudhyadigrita or Saindavadya Taila, or one can have the digestive materials formulated like the Shamoladhyagrita, etc., it can be used, even which is quoted in the Grahani Adhyaya, the Shamula Adhyaya, can be explained, taken for the Snehana, followed by Svedana. Svedana may be with the restricted oil prescribed, like either it may be Brahasindavadi Taila, it may be Shagarbha Taila, or it may be with Kotamjikadi Taila, what we are using nowadays, or ultimately which may not deteriorate the local agni well. Snehapana refers to the Erenda Taila Snehapana usually because it's considered to be unefficiently and it has a balancing capacity of going for not to deteriorate both Ama and Vata together. So Snehapana refers to the Erenda Tailapana since Ama Vata is considered to be well tolerated with Erenda Sneha. That's why the familiar quotation says that Amavata Gajigrasya Sharira Vanacharinaha Eka eva nihantyashu erandagajake. So it is explained like how far the lion is able to control the enraged elephant in the jungle. Same way, the body deteriorated with the ama may be tied up by the erandapana, snehapana, which is eliminating all the debris out and making the amashya as well as pakvashya both in a perfect manner or well working conditions. Vasyayascha marute. The word vasyayascha is used and the plural is used. Usually we make use of basti in the form of kshara basti because there is amata. Basti is useful for the vata. Hence, to eradicate and eliminate the ama, we can use tikshna utna quality drugs like it may be in the form of kshara basti, which contains kanjika, homotra, etc. So, which is once again useful as a part of deteriorate, not to go for the deterioration by the basi. Basi is ideal for all Vatic disorders, but it is formulated by Tishna quality drugs here. And one more Vataka Parvita Vigara, it's advised that Vaitana Basi can be administered, and Vaitana Basi is also equally good in managing the Chikitsa of Amavata. So we can have two important Basi being the Shodhana Basi, and as a part of the Shamana Basi, or it can be also used with the Saindavadya Anvasan Basti because we need a Basti which should be preceded by any Shodhana Basti should be preceded by the one particular Sneha Basti. You cannot go for the Sneha Basti Prakar of other kind. The minimum Sneha quantity which is advocated in the form of Sneham is in the form of Matra Basti. That's also very special Taila. Brihat Saindavadi Taila is used here for the Basti purpose prior to the administration of Shodhan Basti. So alternatively, Madravasti and the Ksharabasti is given for a particular period according to the severity, and ultimately the Vata, Kapha, Anmita, Vikara, Amavata gets controlled. Rukshasvedo Vidatavyo, Valuka Putalisata, Upanahasya Kartavya, Episneha, Vivarjitaha. No doubt, one has to take up a challenge how far the Sweda is effective or not. But still, one need not go for the Stihana, but there are certain Ruksha Sweda varieties available like Valuka Sweda, Valuka Potali, or the Potali prepared out of fried sand and even the Ishtika Churna, or you can also go for Gomaya or the Karisha Sweda, or you can also go for Pashana Sweda, you can go for Ruksha Patra Pinda Sweda. So many varieties are available. Varuka Pataka is considered to be one of the very familiar and easy manner to reach. And Upanaha is once again also to be effective in the form of tying of the medicaments, Kalka or the preparation made out of various Vatahara, Amahara preparations like the Turopanaha or Salvanopanaha, etc. are the examples for Sneha Vivarjitaha. Please take care that nowhere Sneha is directly or indirectly added to it, either during the preparation or during the advocating of the treatment. One should not go for Sneha Bhaga too. Once again, you are supposed to go for Patya Acharana. Pathya, as explained by various texts, says that Eva, Kulata, Shamaka, Kodrava, Shalaya, Vastika, Shiguru, Vastu, Shabu, Karavelam, Patolakam, Adraka, Taptanirancha, Lashunam, Takrasang, Samskritam, Jangalanam, Tatamam, Sam Amavata, Gadi Hitam. So, Pathya list is here, the contextual, and अपत्य लिस्ट संप्रेस सफददि मत्स्यम गुड क्षीरम पोतकी माशपिष्टकम वर्जेत अमवातार्थो मांसम अनुपंच यत् अभिषन्दिकराः which are known for blocking the channel should not be used. Echani gurupichalaha, whatever the food or regimen going to produce blockage in the channel or shruto vibandhata should be avoided. Varjaniyaha prayatnena. One should avoid such either ahara or vikara which makes the blockage, and amapeditaihi naraihi, the amavata pedita person should avoid this thing. Dadimatsya, the gudakshira, upodika, mashapistakam, tushtaneeram purvatam, viruddhani ashanani cha, sapim vegarodhancha, jagaram vishamashanam, varjit amavatartho, guru abhishandik cha. So, abhishandikara, guru guna yukta is specifically mentioned here. Abhishandak leads to further deterioration, so that still ama becomes virulent and ultimately the person may have in trouble. So that's about the amavata. Varjit vidalam gaudyam tailam pinchalameva shitodakena nasnanam. Shitodakena nasnanam. The person, if he at all habituated even, should avoid shitodaka snana. पाचिते च आमदोषे च आमवातं सेवेत् नवसेवनीयं च उष्णं च द्रावं. So till even after becoming away from the symptoms, he should continue the similar restriction. Jware proktani pathyani tani च अत्र प्रयुज्यते. One more statement Harita Samhita is one should follow the strict regimen which is explained under the heading of Jwara, or especially in the Ama Jwara or Taruna Jwara, like Snana, etc. should be Snana, Abhyanga, etc. should be avoided. Important precautions in Amavata complaints, Lepa, Shutapishpadi Lepa, the Shanga Lepa is very ideal to apply. Doshagna Lepa is good. So these are the important Bahir Parimarthik available. And some of the important oral intake of Erenda Taila, Haritaki Prayoga with the Erenda Taila, Aragvada with the Sarshapa Taila, Nagara Churna with the Kanjika, Tirvrta Churna with the Saindhava Shunti and Aranala Bhavita. This is effectively seen as a part of Amavata, being very well yielding Virechana as well as Amavatahara. Tirvrta Churna, Rasnadi Kwata, and this is triturated with Kanjika and Tribrat Kwata. It's very effective. Rasnadi Kwata with Erenda Taila is highly suggested. Erenda Taila with the Shamula Kwata or Nagara Kwata is suggested. Erenda Kwata, Shadhyadi Kwata, Rasona Kwata, Rasna Panchaka Kwata, Rasna Saptaka Kwata, Dashamula Rasnadi Kwata, Madhyama Rasnadi Kwata, Maharasnadi Kwata, Shuntyadi Kwata, Shatapushpadya Churna, Hingwadya Churna, Alambusha Churna, very controversial drug Alambusha. It is explained in the Chakradatta about the Alambusha use in the form of the Churna, Vaishwana Churna, enhancing the Agni, Amrutadi Churna, especially in the chronic Amavata or stage of the Amavata. Devadar Vyadi Churna, once again Vedanahara, Shotahara, Chitrakadi Churna, Agni deterioration is best checked. Punarnavadya, vitality is developed. Abhadya Churna, once again it avoids the further deposition of the Ama, and by which it becomes Saulyahara too. Amavatari Vatika, Amavatari Rasa, Amavateshwar Rasa are the familiar Rasaushadi, which is once again containing many of good preparations. Pramathini Vati, this, though it is not available, but it's highly utilized. Amrita Manjari Rasa, Trifala Dialoha, Vidanga Dialoha, some other preparations. All the varieties of preparations are available in the text. Ajamodhya Vataka, it is, has very enhanced property of vitality developing as well as appetizer and amavatahana. Vatari Gugulu, Vatari Rasa, Yoga Raja Gugulu, two yogas are there, Yoga Raja Gugulu, Brihat Yoga Raja Gugulu and Yoga Raja Gugulu. Vyadi Shardura Gugulu, and most important is Simhanada Gugulu, and Simhanada Gugulu too. Yogas are mentioned under different ingredients and they all useful. Shiva Gugulu or Shiva Abha Gugulu, and Nagara Kwata, Nagara Grata. See, the Shunkya Grata or Nagara Grata is used for various purpose. Shungavirajya Grata, Kanji Shatpada Grata. These are the few grita which may be used by the Amavata patient also, either for Snehana or as a Shamanaushada. Prasarani Taila is told, but this Prasarani Taila is processed or prepared in the Erenda Taila. That's why Prasarani Taila, what is usually prepared in the Tila Taila, should not be used here. It should be used with the Tila Taila, I'm sorry, Erenda Taila being a medium for the preparation of Prasarani Taila. Saindavadya Taila 1 and 2, Dvipanchamuladya Taila, all these things are highly useful and clinically proved. Hence, one can utilize various whether I am provided with a few slides in arthritis. So arthritis, we have inflammation or swelling of one or more joints, describes the conditions that affect the joints, tissues and around the joint, connective tissues. Specific symptoms vary depending on the arthritis, but usually include joint pain, swelling and common. So we have different varieties of arthritis as a whole. When the role of arthritis comes, it may be osteoarthritis, it may be rheumatoid arthritis, it may be childhood arthritis, or it may be fibromyalgia, it may be gout, or it may be lupus erythematosus. So we have to take it granted that from all the angles, by the features explained and the diagnostic approach, one has to arrive which type of arthritis it is. So arthritis as a whole is comprising of n number of conditions. Hence, one has to go through clearly and then you have to step on the treatment. Common causes of polyarthritis are suggested here. Rheumatic fever, rheumatoid arthritis, other connective tissue disorders like SLE, seronegative spondylolisthesis, gout or pseudo-gout, foreign protein reaction. There is a serum sickness. There is a very specific condition that should be one example for polyarthritis. Polyarthritis is more than 3 joints are affected. Infectious arthritis, viral arthritis, purpura, and arthritis due to systemic diseases like leukemia. So coming to the chronic, so far called acute conditions, coming to the chronic rheumatoid arthritis and other connective disorders are here. Seronegative spondylolisthesis arthritis is explained here, called as SSA. Gouty arthritis, osteoarthritis, HIV-associated arthritis, and sarcoidosis are the other varieties available with the chronic condition persisting with polyarthritis. Coming to the common cause of monoarthritis, acute infectious arthritis, rheumatic fever or hemorrhoids, gonococcal arthritis, gout or pseudo-gout, septic arthritis, rheumatic joint disease, Lyme arthritis, etc. Coming to the chronic manifestation of monoarthritis, when the wound single or solitary or joint is affected, one has to think of if it is chronic one, infectious arthritis, either fungal or tuberculosis may be the reason. And usually in the clinical picture, this comes as a tubercular arthritis, most commonly seen with. Post-traumatic, the patient is suffered with the injury priorly, where the arthritis is persisting, one can have the history of trauma. Osteoarthritis is very familiar with the monoarthritis and it's distinguished by its unique features. Gouty arthritis is also having metabolic disorder, having similar picture with the single joint. Also, it can involve neuropathic arthropathy and neoplasm, cynomoma, or pigmentovillous nephritis. These are the examples for chronic monoarthritis. Coming to the rheumatoid arthritis proper, it's a chronic inflammatory disorder affecting more than the 3 joints. In some people, the connective tissue damage will be seen as a body system, including the other areas of the body like lungs, heart, and blood vessels. And autoimmune disorders are also considered to be occurring when there is a failure in the individual to compromise the immune system, and this leads to mistakenly attacks their own body tissues. So during the immune system failure, mistakenly our own body particles, system attacks the body tissues. Definitions, etc., is a chronic multisystem disease of unknown etiology characterized by persistent inflammatory synovitis, is usually peripheral joints of systemic fashion. Although cartilageous destruction, bony erosions, and joint deformity are hallmarks, the course of the development can be variable, like an association with the HLERA DR4 has been noted. Both genetic and environmental factors may play a role in the disease. The propagation of RA is an immunologically mediated event in which joint injury occurs by the synovial hyperplasia. So hyperplasia of the synovial joint takes place. Lymphocytic infiltration of synovium takes place. Local production of the cytokines as well as chemokines by activated lymphocytes, macrophages, and fibroblasts. These are the some hints towards why the disease occurs or really producing the damage. Coming to the other causes, the exact cause, though it is not known, but this is a case of immune system failure where mistakenly healthy tissues are attacked by the body immune cells. The triggering factors are unknown, could be including the age. Age factor is affecting about for more than 40 years. Obesity is having the risk. Family history of rheumatoid arthritis is once again the point to cover. Cigarette smoking or any immunosuppressant conditions, faulty diet and erroneous habits predisposing the more incidence of rheumatoid arthritis. Coming to the clinical manifestations, occurs about 0.8% of the population. Females are affected 3 times more than the male. Prevalence increases at the 4th and 5th decades. Articular manifestation starts with the polyarthritis of peripheral joints with pain, tenderness, swelling of affected joints, PIP and MCP being frequently involved, morning stiffness, joint deformity after persistent inflammation. So ulnar deviation or Z deformity etc. are going to, or swan neck deformity etc. are going to take place. Extra-articular manifestation, when the person is affected with rheumatoid arthritis, may show the symptoms in other than the joints. That suggests by the cutaneous manifestation like rheumatoid nodules or vasculitis. Ocular or the pertaining to the eyes, it may be keratoconjunctivitis sicca, episcleritis, scleritis, etc. Hematological refers to the anemia of French syndrome where the triad like joint pain, splenomegaly, and neutropenia are persistently seen. So it's French syndrome. Coming to the cardiac manifestations as a part of the rheumatoid arthritis, myocarditis and pericarditis are usual outcome as a complication. Neurological myelopathy secondary to cervical spine disease, entrapment, vasculitis, etc. Pulmonary manifestations includes nodules. You know the fact that rheumatoid nodules also can occur in the lungs, interstitial diseases, Kalpan syndrome, and all other possible complications are seen. Coming to the evaluation, history and physical examination of the all joints are necessary. RA factor signifies the severe disease presence of the nodules and extra-articular features. Laboratory tests complete blood picture and ESR, CRP are useful to confirm. Synovial fluid analysis to rule out the crystalline disease, infection, etc. Radiographs suggest that juxta-articular osteopenia, joint space narrowing, marginal X erosions, chest X-ray should be explained, evaluated. Mainly attacks the joints, usually more than the 3 joints at a time is going to have, especially the hands, wrist, and knee and ankle with the rheumatoid lining of the joint becomes inflamed, causing the joint tissue. This tissue damage can cause a long-lasting and unsteadiness and deformity. RA can also affect other tissues throughout the body and cause problems in organs such as lungs, heart, and eyes. Signs and symptoms. Already explained: pain, stiffness, tenderness, redness. So, as a part of the manifestation, there will be warmth over the joint, weight loss, fever, fatigue, tiredness, weakness. Disease can be associated. Prevention. There is no known way of prevention. However, one can avoid habit of smoking, weight management through exercise and proper diet regimen. One can avoid it, or early treatment avoids all the complications. Risk factors already explained: age, sex, and genetics. Age is usually middle age. Sex, female are more affected. Genetics coming to the inherited or the particular risk of may be highest when the people with these genes are exposed to environmental factors like smoking, or even the person is obese. Uh, Surprisingly, characteristics that can decrease the risk is breastfeeding. The women who have breastfed their infants have a decreased risk of developing RA. It is observed by the survey. What are the complications? Complications already explained in the form of quality of the life, and it avoids disability, it avails disability, premature death, premature heart disease, obesity, employment problem. All these things are the complications. Diagnosed by the signs and symptoms, and within the 6 month, if at all it is detected and well treated, it is worthwhile, whereas the later treatment becomes deteriorating and can reduce slowly but steadily. If at all it is ill-treated or confusion with the early management, one can have difficulty in managing. Differential diagnosis includes gout, SLE, psoriatic arthritis, infectious arthritis, osteoarthritis, arthritis, Ritter syndrome. Treatment of RA consists NSAID, DMARDs, corticosteroids, biological response modifiers. So these are the important treatment that can be avoided, and how far the NSAID can be given. Non-steroidal anti-inflammatory drugs, disease modifying drugs are given. Corticosteroids are given as a part of a third phase of the treatment, and ultimately biological response modification is also available, which are once again giving guidelines for NSAID. No definite variations one to another. Already any damn NSAID may be working. Many may vary in different individual, but there is no proof. Individual response combining less cost of therapy and concurrent drugs are to be used. Combinations may increase the toxicity and the cost. Dosage should be individualized, especially adults. And there are DMRDs, disease modifying drugs, and it's given with the guidelines. Corticosteroids highly suppress the inflammatory process. They are responsible for reducing the inflammation, but its side effects are making its use very judiciously. It's used as a bridge therapy. Minimum dosage temporarily with NSAID and DMRDs will have quick response, whereas steroids can be used with the bridge therapy along with to combine it to catalyze the other treatment. One can adopt this treatment, but as far as the systemic involvement is highly toxic if at all it is used for a prolonged period, and intra-articular steroid therapy is also seen as useful if at all one of the joint is inflamed out of the proportion. General disease activity. Local steroids are helpful in tenosynovitis and carpal tunnel syndrome, which are the complications of rheumatoid arthritis. All the treatment failure because of the patient may require small doses of daily oral dosage and symptomatic relief and functional ability of the joint. Pregnancy will not prednisolone will not cross placental barrier, and up to 20 milligram per day can be safely given in NSAID, as NSAID are not safer like this. So anti-cytokine drugs are to be used like infliximab, anaparin, How to manage RA and improve quality of life. Rheumatoid arthritis affects most of the persons living, including work, leisure, or the economy status also. Hence, some modification in the lifestyle and other adjacent therapies or so-called the physical activity, or say that he says that physically active for 150 minutes per week, all these things are can reduce the risk of complications at least, or may have positive attitude towards the treatment. Hope that I have reached in all around the rheumatoid arthritis also. Thank you for the opportunity. Thank you for patience hearing.
Thank you so much. It was such an informative session, sir. Thank you, sir.
Thank you.
Is there are any question you can write in chat box? I can ask, sir.
Okay.
Uh, Session was so good, sir. I think no one is having doubt.
If it is there, we can clarify.
Sir, there are no questions in chat box now, sir.
Okay. So I would like to thank the organizers once again, giving me an opportunity, and all the audience or the persons who are in the stream of audience, and all the patients hearing. Thank you. Thank you for the opportunity.
Thank you, sir. I consider it as my privilege to be given this opportunity by SVAK and my HOD, sir, Dr. Shripati Acharya, sir. Now I call upon Dr. Bhavya for a vote of thanks.
A graceful evening to all who are attending the webinar on Amavata on behalf of SVAK in collaboration with Munial Institute of Ayurvedic Medical College and Sri Paripurna Sanatana Ayurvedic Medical College. My very special thanks to today's speaker, Dr. Veerakumar K, Associate Professor, PG Department of Kaya Chikitsa, SDM College of Ayurveda, Udupi, for sharing his clinical expertise on the topic of Amavata. Thank you very much, sir, for making this topic a very simple topic. And thank you once again for your excellent speech. And I am very happy to extend my thanks to Captain Ganesh Karnik, State President SWAC, and my special thanks to Dr. C. Renuka Prasad, Working President SWAC. I would like to thank our Paramapuja Professor Dr. A.V. Srinivasan Swamiji, founder Sri Paripurna Sanatana Charitable Trust, and my sincere thanks to Sri Ramesh H, State General Secretary SWAC. And I'm very much thankful to all the coordinators of SWAC. At the end, I would like to thank all the SWAC and EC members, and at the end, all the faculty members who are attending the seminar, BMS students, Ayurvedic doctors, and general public who have spent their valuable time in gaining the knowledge about Amavata and making this webinar a grand success. Thank you, one and all.
Thank you.
So, before we end today's session, on behalf of SWAK and Dhanvantari Vedike, I wholeheartedly thanks again the entire team. We have been hosting a series of webinars, and our main inspiring and connecting person, Shripati Acharya sir, for him, and more than 2 months we have regularly all this mission of spreading Ayurveda to all. So on behalf of SVAK, I invite all the participants to join hands. It doesn't take any cost, but it takes only the efforts and your wish and will and your participations. So I request again all of you to join this Dhanvantari Vedike and expand the spreading of Ayurveda to every person, every home. So with this, we conclude for today's session. Thanks a lot, sir, Veer Kumar sir, for your excellent presentation. I think that has answered many questions itself. That's the reason we have not found any specific question. Please continue with us and join hands to continue this dissemination of Ayurveda to all. Thank you, sir. Thank you all.